My name is Pam Duffy, and I'm reporting on the effects of the Count the Kicks mobile app on the rate of stillbirth. My collaborator is Lyndi Buckingham-Schutt from Drake University. We have no conflicts to disclose. Our objectives are to define risk factors for miscarriage or stillbirth, describe effective prevention interventions for prevention of stillbirth, and understand the value of mobile health apps for primary prevention of stillbirth. Because there is a cadre of evidence around this topic, we conducted a research study in 2019. Our project examines relationships between use of a mobile app for measuring decreased fetal movement and how it is associated with birth outcomes. We know that decreased fetal movement, as reported by the mother, has never been paired with app user kick counting data. So this is a first of its kind study. This research can help inform healthcare providers about recommended amounts of fetal movement during a specific time period and recommendations to the mother for monitoring fetal movement. What we do know is that 50% of pregnant women worry about fetal movement. Less than 16%, however, consult a medical provider for decreased fetal movement. We know that knowledge of reduced fetal movement reduces a delay in provider consult and in the rate of stillbirth. There's inconsistent evidence about the advice to the healthcare provider on standards and the advice the healthcare provider should give to pregnant women. And daily fetal movement monitoring is an important experience and indicator of health of the fetus for pregnant women. What we don't know is the effect of evidence-based mobile health apps to track fetal movement. Modern methods to increase knowledge and understanding of fetal movement are just becoming more popular. We need to understand them better. We don't know about any measures of emotional well-being associated with tracking fetal movement. And what are the standards that we can advise women about for fetal movement monitoring during the pregnancy? What is stillbirth? Well, it is the death or loss of a baby before or during delivery. And it is classified by an early stillbirth as a fetal death occurring between 20 and 27 completed weeks of pregnancy. A late stillbirth occurs between 28 and 36 completed pregnancy weeks, and a term stillbirth occurs between 37 or more completed pregnancy weeks. In the United States, 1 in 160 pregnancies result in stillbirth. In Iowa, the stillbirth rate is 3.9 per thousand. The United States average is 5.9 per thousand, but for minorities, it is 10.3 stillbirths per 1,000 live births. This disparity must be addressed. The risk factors for stillbirth include various medical conditions as comorbidities, socioeconomic status, gestational weight gain, race and ethnicity, and lifestyle choices. The causes of disparities include inadequate prenatal care for the mother, and recognizing that that first 9 months, which is the pregnancy, is so important for programming the brain of that fetus and newborn. So you need to look at preconception health status, access to health care, and socioeconomic status. We can see by race and ethnicity the differences between stillbirth rates for various categories, with non-Hispanic blacks being the highest. Preventing stillbirth includes the sleeping position of the mother and recommending that she not sleep on her back at 28 weeks or more, that she should have regular checkups and communication with her healthcare provider, that she should learn the movement patterns of her baby, and that can be done by counting kicks and seeking help if decreased movement is perceived, and having a healthy lifestyle, that is, limiting the amount of weight gain during pregnancy. Working with her healthcare provider, obviously, on that. So we want to introduce you to Count the Kicks, a mobile app from a nonprofit organization in Iowa, and you may be familiar with them. It's a stillbirth prevention public health campaign which is evidence-based and educates women on the importance of tracking fetal movement. And there is a free app or paper charts that the woman can use to track the fetal movement beginning at the 28th week. This empowers moms to speak up to healthcare providers if they have a concern. The Count the Kicks app is available in various languages. You can count for singles or multiples. You can learn your baby's movement patterns over time and then recognize when there is a change in that pattern. With that information, the woman is empowered to contact her healthcare provider. We know that mobile apps have certain desired features from research that's been obtained, and the Count the Kicks app provides these. It's an app that sustains interest over long periods of time. It's free to download and set up. It includes features to help users track health-related behavior. It provides feedback and advice that guide the user. There's accurate and reliable information and tracking functions, and it's able to be used on the smartphone if the user is opening other apps at the same time. In our research project, we conducted a phase 1, which is a pilot study to gain feedback and appropriate revisions to our pilot survey. We then surveyed 19,000 app users and got a response rate of 264. That's 1.37%. And our marketing specialists say that's a high rate, but we redesigned the survey for the 2015 to 2019 app users, sent an additional 51,000 more emails, and had a response rate that increased to a 2.34% return rate. That's 1,199 survey responses of app users so that we could compare app user data with reports of the mothers on their pregnancy using the app and pregnancies in which she did not use the app. Let me present the results, some of which are quantitative and some are qualitative, in that they were open-ended response or they allowed the woman to provide survey data which we could then analyze for our results. In terms of characteristics of our participants by pregnancy, we looked at the type of antenatal care that they received, the gestational weight gain, any drug use, and their pre-pregnancy height and weight. Greater than 70% of women used an OBGYN. The majority of women reported greater than 35 pounds of weight gain. And the mean pregnancy BMI was 20.8 kilograms per mass. Now, at the top of this chart, we have P0 to the far right. That is the pregnancy in which our participants use the Count the Kicks app. And P1, 2, and 3 are pregnancies before using the Count the Kicks app. Our preliminary analysis shows that there was a statistically significant reduction in the rate of stillbirth for the pregnancy that the mother used the Count the Kicks mobile app compared to up to 3 previous pregnancies in which she did not use the mobile app. These findings are preliminary, but very promising in showing the effectiveness of the Count the Kicks app. We did find, in studying the characteristics and reports of the women using the app in our survey responses, is that there was a positive impact in the feeling of emotional support, including reduced anxiety, bonding between the mother and fetus, as well as bonding with the family, more confidence in being able to monitor the baby's health status and how the pregnancy was going, and feeling comforted. Some of the reports, and I quote, include, "My first pregnancy ended in miscarriage, so this was a lifesaver. My second pregnancy, it eased my mind. The app was a wonderful tool for me during my second pregnancy. My 4-year-old used it with me to count his brother's kicks at night. It made him feel close to the baby and definitely eased my mind regarding the health of the baby." So in our survey, we found that 69 of 292 women gave us feedback with words like comforting, helped me bond with the baby, gave me peace of mind, helped me feel better and understand my pregnancy, kept me calm, helped me be less anxious. It was reassuring and helped my confidence. When we paired this survey response with app data, we found that 82% of women reported less anxiety when using the Count the Kicked app. 51% of women reported Count the Kicked helped with bonding. Regular tracking was associated with feelings of bonding. And women that track movements daily were more likely to feel less anxious about their baby's health. We also found that the app was associated with a heightened awareness or knowledge by the pregnant woman. 114 women found the app helped tracking fetal movement. 10 sought advice or care from a medical provider. 10 said they had data to share with their medical provider. And they use words like kept me aware of the baby's movements, helped me be mindful. I learned what was normal for my baby, and it made me aware of the importance of counting kicks. To the left of this slide, you can see some of the direct quotes from the women who use the app. The one at the bottom is, quote, "It taught me to be aware of baby's movement frequency and know how to know when to worry and when to go in to see the doctor. It gave me specific numbers to use should I need to go in and describe to the doctor what was going on." In this graph, you can see that there was an association between the frequency that the women were using the app, and that using it daily versus monthly or rarely was a greater association of the reported understanding of the baby's movement pattern. 74% of women consulted a healthcare provider when they were concerned with a change in movement. And women that contacted their healthcare provider for a change in movement were more likely to have an appointment for decreased fetal movement. In conclusion, we found that the mobile app supports healthy pregnancy through providing emotional support and increased knowledge. There was a demonstration of effectiveness of the mobile app in pregnancy to track fetal movement. There were benefits that extended beyond the mother to the family members, and the app data was used to facilitate care seeking and communication with healthcare providers. Co-investigator Dr. Lyndi Buckingham-Schutt and myself would like to acknowledge all the collaborators who contributed on our research team, including Mr. Ben Williamson, Ashley Armentrout, and Carrie Biondi Moreland. We also acknowledge that the app data that we use for analysis and partial funding for the research project were provided by Healthy Birthday, Inc., a 501c3 nonprofit organization, and the creators of the Count the Kick Stillbirth Prevention Campaign and mobile app. For more information, for slides, or for a list of our references, please contact me at the email you see, pam.duffy@dmu.edu, or my office phone, 515-271-7811. Our list of references is provided here. We have a research project that is under review now in a peer-reviewed journal, and we hope to have this published yet in 2021.